Welcome, Divya. It's very nice to see you, and thank you so much for coming today and joining me in this conversation.
Yeah.
And as with all my guests, I want to ask you to, at the outset, tell us what turning point you want to talk about
Yeah.
today.
I think if I have to look back at anyone that has left me changed as a person, and you almost wonder, will I ever be the same person again? I think for me, that defining moment was when I lost my mom in December of 2018. And I think suddenly it's almost like this whole new awareness comes in, and I don't know whether it's for me, this was the first time I've ever experienced grief, but so much unfolded after that, and so many life decisions that I took, which I'm very glad I took, that it just felt like for me, just that experience um, was very, very different from for me compared to the others that I may have thought this was my defining moment. But I think this truly was it in 2018.
Yeah, and it's an interesting point because when we lose a parent, it is such a life-changing thing. But
Mm.
I'm curious to just maybe delve a little bit deeper into that because
Mhm.
you work with people
Mhm.
who suffered huge grief. So you're not unfamiliar with
Mhm.
grief and what that does.
Mhm.
And I suppose my question is that what happened for you? Was it an unexpected, you know,
Mhm.
death, or was
Yeah.
it the fact that, you were very close
Yeah.
to your mother?
Sure. A bit of both, Rohini, and I like the parallel you drew between the work I do and me being familiar with grief as well. But when it hits you, I think it's a very whole different experience. And I mean, I used to work with, and I still work with people with spinal cord injuries, and they used to keep saying that it's very tough for you to understand what we've been through because you don't know what it's like to sustain an injury, and I totally agree with that. And I think if grief is one leveler or one way that one can connect with people, I think this was for the first time something which I could resonate with when I was working with that population. It wasn't unexpected in a sense that she had been diagnosed with a chronic respiratory problem earlier that year, which isn't something that's supposed to curtail life this quickly. But I think her disease progressed so rapidly and so progressively, despite all the attempts we were making in terms of trying to arrest the deterioration. But yes, the end, however much we may be prepared for it, isn't something that we truly come to terms with. That bit was a sudden bit because we'd keep hearing doctors saying she's going to be here for a while, but just the way it just progressed so rapidly, that bit came about as very unexpected. I've always prioritized family over everything else. I mean, of course, I love the work I do, but for me, it was always very clear that for me, I am going to be my parents' caregivers. And that's the reason I also moved back from the US in 2007, 6, to be able to take care of them because, aging was catching up. So for me, that being the focus, I think, like you rightly said, the affection, and I was her sole caregiver when she was deteriorating. I think all of that mix made it more challenging for me in that way. The reason I call it a turning point is because up until then, you're going about life. It's almost an autopilot. You're working in this setup, and you're happy doing what you're doing, but you never focus on what you truly want, and are you truly enjoying what you're doing, or is this really something that's meaningful? So suddenly after her passing, I think I started questioning, like, what's the whole point? I mean, what are we doing here? And I think all those existential questions started coming around, and I honestly realized that I wasn't happy working at the place that I was working at. And I'm like, it's been years that I've been thinking maybe I need to do a change, maybe I need to shift. And I decided to actually call it quits there and start working on my own. A lot of people advised me saying, you're in grief, you've just been through one major transition and you're thinking about doing this major transition where you're working, starting off on your own. Are you sure? And so a lot of people questioned my decision making at that point. but it was with a lot of lucidity, a lot of coherence, that I said, no, this is what I finally want to do, because this is what my mother would have liked me to do rather than be miserable. She would have said, you know what, it's a leap of faith, go ahead and take it. And so that for me was a huge turning point where I became my own boss, and truly I've loved it. I mean, it's been one of the best journeys so far that I've been on. And of course, amongst other things, there were, why are we hanging out with the people we hang out with? And it's like you suddenly, it's like you have a magnifying glass and you're looking your life through it and beginning to question, saying, why have I been living this deluded self? I mean, suddenly there was clarity and there was vision and there was actual hope and living that came from that experience, that very painful till this date experience. But sometimes they just are here to teach a lesson.
Yeah, yeah. So the one of the things you did was obviously you changed, you went into your own practice, didn't you? You quit the
Yes,
job you were in.
yes.
So what were the other things you did? Because you've done some really exciting things as well.
Right. Yeah. So I'm a long distance runner, and one of the things I wanted to do again was a bucket list ultra marathon. So, and of course, mom used to struggle for every breath that she could take, and I wanted to set myself a difficult challenge where I said my first ultra marathon would be in the mountains of Ladakh, which is at a high altitude, and oxygen anyways is just 50% of what it's at sea level. And so I said, this one's for her. So I trained for almost 2 years after her passing. And of course all these organized runs kept getting cancelled, but I said, life shouldn't be made to wait. I think we've just got to take this. So I did my first solo ultra marathon this past Sunday, September the 19th. And that was also another big turning point for me, where I literally got to know more about my own potential and how the mind works and how the body functions, and mind over matter bit. Again, literally seeing it in practice that day.
How do you train for something like that? I mean, do you actually have because if there's less oxygen, is there
Mhm.
a way to simulate that sort of conditions?
So that was the tough one. No, there wasn't, unless. So, of course, I did go 2 weeks before the run to Ladakh, just so that again, I was acclimatizing well. And I think that's the best you can do if you can spend 2 to 3 weeks before something like this, where you're going to be on your feet for more than half the day. So that's how I trained for it. But and then of course putting in some hill runs. Again, nothing compares to the mountains of Ladakh, but I went to a place where I did another 33 kilometers at an altitude of about 6,000 feet, which is really half of what I would have done in Ladakh. But that's how, pretty much just kind of testing your endurance on an uphill run in that way. But no, the oxygen bit was the surprising one. I mean, the only thing you can do is just practice deep breathing, pursed lip breathing while you're just walking every day and just covering distances. So I would be on my feet for about 10 to 12 kilometers every day for about 2 weeks before the run. And that truly helped. And then camped for the very first time at 16,000 feet. I've never camped before, but this was one I said, you've just got to open yourself to all these experiences and cross all these self-imposed barriers that we set, saying, oh, how can you do this, or what if this happens? I'm like, just bring everything on. So crossed quite a few levels on my firsts in my trip to Ladakh.
Gosh, that's so impressive. So you said it was a solo marathon, ultra marathon.
Yeah, yeah.
So you were on your
Hmm.
own through that
I
whole
was
period?
So I was on my own. I had a friend with me who has coached me through this, and honestly, without him, I wouldn't have been able to do that. So yeah, so when I say solo, he was there, and then we of course had the owner of the guest house we stayed in crewed for us, and then I had a very dear friend who came and cheered me on for a part of the run. There were supposed to be a few other people, but there were quite a few dropouts as expected. But it was the two of us who marched on and finished it.
One of the things I wanted to ask you, given your work with other people's grief, is I've heard of this term vicarious grief,
Mm-hmm,
where
mm-hmm,
you pick up other people's grief and it kind of almost feels like your own.
mm-hmm.
Have you ever experienced that in your work?
Of course, I mean, and I keep saying we're all human, so we are as prone to making mistakes and errors and experiencing that vicarious trauma and grief that one does. One has to be very mindful. And I've been asked this question, that how do you keep yourself, so detached, if one may use the word. It's, you have to see it as being in the moment and working with someone. And I've always felt that if you're not giving in your best, then you can't really help someone else. I've been very careful about vicarious trauma or compassion fatigue creeping in. At the end of the day, you have to see it as, this is work, I'm leaving my work here and I'm heading home, and one has to re-energize, replenish the depleted well that happens over the course of days. So there's a lot of self-care that goes on in the life of a psychologist who's working with so much grief and suffering as spinal cord injuries, to give an example. So yeah, but I think I don't let it. I've honestly, Rohini, had it uh, slide by once when it impacted me so much that I had to take about a couple of weeks off from work. And for me, that was a great lesson. So you can't just let it fester and simmer. You've got to keep taking care and taking charge. And so after that one incident where I had a little bit of a break that was needed, I came back and realized that you have to just do daily, whether it's meditations, walks, runs, processing it with a colleague. One has to just let it go and come back the next day recharged.
Yeah, yeah. And you also mentioned earlier that you're losing your mom and kind of really maybe refocusing on the way you saw
Mhm.
yourself in your life.
Right,
One of the areas was self-care and doing more of
right,
that. So
right.
given that you were already aware of the things you needed to do and you were doing them, what more have you discovered that you need to do for yourself?
Um, Honestly, not waiting for things to happen, and I think just enjoying life as it comes. And like I said, there was a lot of um, things one would do because it was expected, or that's how it should be. One needs to socially connect, and one needs to do this and that, whether or not you liked it or not. And I'm like, I did that, and I said, no, it's more about what makes me happy or what brings meaning to my life. So it continues to be the focus, being taking care of my dad, or hanging out with my sisters, or travel for that matter. I don't, like I said, I mean, I could have waited for the organized run to probably come by next year, but I'm like, I want to do it this year. Life shouldn't be made to wait. And so whether it's another bucket list run that comes by, it's just that you just keep enjoying it. And I think just focusing on what actually matters to you, rather than what you're doing for, let's say, to because it's expected of you. So I dissed a lot of those expectations and beliefs people had.
Yeah. And
Yeah.
can you talk a little bit about your mother? Because obviously she was a
Mhm.
huge influence
Yeah.
in your life.
Yeah.
What were the things that she would have loved to have done, but maybe never got a chance
Hmm.
to do?
Yeah. And I hope I can get through this segment without tearing up, but that's okay. I think so. My mom definitely had a difficult time, because I'm the youngest of three daughters, and all her life she kept hearing the fact that, oh, you don't have any sons, and so of course that's something which typically used to happen in India a lot, and she kept saying that my daughters are my sons. So one of the things she totally emphasized on was education and on self-reliance. So she told all three of us, saying, education is one thing that nobody can take away from you. So make sure that you are educated well. And and I will always remember this. My dad was in the army at that time, and all three of us were in school. And so she started working because she wanted her daughters to get the best education. And so so for me, that's the sacrifice that I think, or maybe her own will to want to make sure her daughters excel. So she did stuff like that, and all three of us went ahead and got PhDs. And my grandfather used to tell her, very typical of the patriarchy, that what's the point of educating them so much? They're only going to make rotis at the end of the day, and they'll be cooking at home. And she said, no, that's not what my daughters will do. So she of course fought a lot. I mean, she fought for us, and she made sure we were self-reliant people. One of the things she did, which I'm so proud of her, was in the 90s, when girl child or children weren't educated as much in the villages of Haryana. She went and convinced the villagers that she was setting up a school and that she wanted kids to be educated, and especially the girl child. So she fought against all odds, and of course, people must have given her a dressing down as well. But she persisted, and she set up this school where she became the principal and started teaching those kids. Up until, so she passed away on December 26th. On December 3rd, we went to that school after many, many years, and mom was, even though she was unwell and she was in a wheelchair with oxygen hooked to her, just the spirit that I saw in her when she saw those kids, and, her old office, I think for her, just seeing that, that's such a beautiful memory I will always hold. But for her education, the girl child were all very, very strong passions that she had. Even here at home, she would, tell all the maids to bring their kids, and she would teach them. I think she would have just wanted to spend more time with family, see the grandkids get married. I think she was just looking forward to a lot of those milestones. But I would say she was a jack of all. I mean, she was so talented. I mean, be it anything that was gadget related, mom would know how to fix it. She of course had aspirations to study and to be a doctor or an engineer, but again, back in those days, wasn't something that was encouraged. But she made sure that she lived through her daughters. But yeah, I think she just kept saying that this disease just came and sapped her so much that I think she still fought till the end, and she just made sure that she was there for all of us, never let her sorrows show. But I just hope she's in a happy place looking at all of us, and who still remember her and miss her so fondly.
Yeah. Well, what a beautiful legacy to have left behind, you know.
Hmm.
Of
Right.
course, you and your sisters, but also that school
Hmm.
and
Yeah.
an impact
Yeah.
in people's
Hmm.
lives. So thank you
Right.
for sharing
Right.
that.
Sure.
And
Sure.
I mean, tell me a little bit about your work, and I think in particular
Yeah.
the,
Hmm.
the work you did with people with spinal cord injuries.
Sure.
That's a very
Sure.
specialist
Yeah.
area. How
Yeah.
did you get into
Yeah.
that?
Yeah. So of course, I was at the Indian Spinal Injury Center, which was where I did my internship when I was doing my master's. And that's where I realized, I said, this is one place I really want to work with. But you realize that when you're working with chronic disabilities or sudden impact disabilities like a spinal cord injury, all clinical psychology theories that you've learned in school don't work. So that actually inspired me to go ahead and do my PhD in rehabilitation psychology. So I went to the US and got my PhD there, and I wanted to come back to India and work over here. Honestly, it's been one of the best experiences working with a lot of these people who got, injured in accidents or a fall from height or anything which left them completely paralyzed, either neck or waist down. Been the most meaningful 12, 13 years that I spent at that organization. Met the most wonderful people, Vaidy being one whose loss again was something which left all of us so shattered this year. But and more importantly, I think just being there as a support and counseling these people and their families. Like I said, I've had the good fortune of meeting so many wonderful people who continue to be great friends or who have been indoctrinated into my family or whose families I've been a part of, but very, very involved. Nothing like what I've ever done before or continue to do. But so just working with them and their families has been a lot of a big out of the box experiences as well. But like I said, I mean, no textbook can teach you what life teaches you when you meet these people.
Yeah, and you've met some really interesting, people,
Hmm.
some of whom I know as well, and their life
Right,
story is,
right.
stuff that is hard to imagine how anyone can get through so
Sure,
much trauma.
sure.
So
Mm-hmm.
what's kind of been the, I suppose, the key theme of what separates someone who goes on to survive and even,
Mm-hmm.
thrive compared to somebody
Mm-hmm.
who gives up and maybe whose life
Mm-hmm.
is limited as a result?
Yeah, yeah, yeah. A lot of it, honestly, there are so many different factors, Rohini. One, of course, uh, the psychological strength and the resilience, being able to just bounce back from an adversity like this, and to say that, okay, no, this is not over, or I need to take charge. Being able to manage their lives and figuring out ways of doing that, of course, is one of the biggest determinants. If I had to look at somebody who survives well and who says, yeah, I am I am a person who's educated, who's working as such and such, who's a part of a family, and I have a spinal cord injury. So it's for them, it's like, yeah, it's a part of my life, but it doesn't dictate who I am. For some, when it becomes the overarching, the only thing that defines them, and of course they look at it from the limitations, and of course the limitations are very severe, but when they get bogged down by that, the quality of life is typically not the best. So somebody who believes they can manage it will find ways, will find solutions, will focus on rebuilding and actually having a good quality life, versus someone who says, no, can't step out with this, and this is not how I want to live. The other thing in our country, Rohini, in India, is the financial and other resources. So somebody who may just be very strong-willed, may fail in the absence of either money or a strong family support, or a job. A lot of them are people who are manual laborers, who are working in fields, and so if they're not qualified and they lose their limbs, just figuring out what they can do with their vocation tends to be a big influencer as well.
Yeah.
So, but yeah, the spirit, the like I said, but a lot of people say, but that can't put food on the table. But a lot of people, for them, the adjustment of, okay, if I can't do this, what else can I do? And they come up with solutions that also then kicks in some good responses to the injury as well.
So it needs a multi-pronged approach, doesn't it?
Absolutely, absolutely. You can't do without a job, without the family support, without the community support as well. And of course, at a larger level, just things like accessibility. Again, if you want to step out and you find there are steps and no ramps, that of course will then be like, okay, I've done my bit. Where's the other part that needs to kick in?
Yeah. And of course, Vaiddy and his organization and, other
Hmm.
organizations have done a lot of work
Sure.
in terms of, increasing awareness. I think,
Hmm.
a lot of the time people are not being deliberately thoughtless
Hmm.
or cruel.
Hmm.
They just don't know. They don't think
Sure.
about how
Right,
it's going to
right.
impact. So
Hmm.
how much change have you seen over the 12, 13 years that you've worked in this field?
Honestly, again, it depends in which dimension we are looking at. But I think one of the areas where I've seen it change is, you know, uh, in terms of a lot of people, and earlier it never used to happen as much, are dating and getting married. And it's not just, person with an injury marries someone with an injury. It's like it could be somebody who's got a spinal cord injury getting married to, or dating someone who's able-bodied. So those trends, a lot of stigma is reducing around that. Of course, they have their uphill challenges. I mean, all of them do face some flack or the other, but I've noticed that being a trend that's increasing. Vocational rehab is picking up. I wish it was a little faster. I wish there was more provision for training people with disabilities. But like you said, where these organization makes sure that they are focusing on peer mentor training, or just kind of making sure people are financially getting more independent in that way. So definitely accessibility is getting better, advocacy efforts are getting better, people are more vocal about calling it out, saying, hey, you have steps here, you need ramps here. So I think there is a little bit more social consciousness and CSR efforts, but I hope that that trend is, it doesn't need to be uh, fought for so much, and it's more of a conscious effort. And
Yeah. And so
yeah.
when as part of your own practice, what kind of people do you work with?
Hmm.
Is there a sort of, specialization, or does
Sure.
anyone
Yeah,
go
no.
along?
So I work now, I know that I've, kind of made it again. That's the other thing where I've said I'm just going to work in the niche area. So I work with people who are primarily, facing any depressive disorders, anxiety disorders, or stress. And the other bit that is a strong component of my caseload is is couples therapy. So that's something that, but again, beyond that, I don't work with kids. I only work with adults, and these are the broadly 3 4 areas that I work with.
And you moved away from the spinal cord injury.
Yeah,
Yes.
I think, well, I was talking to another colleague of mine who has been a strong, strong mentor for me since my internship days. And when I shared with him the decision of, he lives in the US, and when I shared with him the decision of, going out on my own and getting into and changing gears in my practice, he said he understood that, because he said there's only so much suffering that even he could take working in a hospital or in a ward setting. And he said it gets to you. There's honestly a shelf life to our work, and especially for somebody like me. And I will say that I've been cautioned that I get too involved, or I'm too over empathetic. And so, therefore, compassion fatigue was going to be a very strong constant in my life. I tried changing that. I mean, how do you stop from being compassionate? But yes, of course, boundary setting was essential. But I think when you're seeing suffering day in and day out, there is a point beyond which it gets to you. I won't say that's what it was. It was just that I was happier working with Vaidy, let's put it this way. So I had told him that I'm not. I mean, I would love to work with people who don't have access to resources, and so that's why I became a consultant with Ganga Foundation. So I
Yeah.
won't say that I stopped working, but yeah, my work with Vaiddy in peer mentor trainings, and his touch rehab projects, those kind of increased once I moved away from the hospital.
And I think that's a really interesting point, because, there's many levels of
Mhm.
engagement that's needed to help
Mhm.
someone.
Mhm.
Because, obviously when they first have the injuries,
Right.
it's a very different kind of grief. But then
Mhm.
as they move on in life and they're trying to
Mhm.
integrate themselves, there's a
Right.
different challenge. So
Right.
what I'm hearing is that your kind of engagement sort of moved away from that initial
Right.
bit,
Right.
actually in, in
Right.
the space where they're actually learning to
Sure.
integrate themselves.
And honestly, you've hit the nail on the head, Rohini, because what happens is people in the hospital and in the acute stage are focusing only on physical recovery. However much they know about the prognosis, and that it's permanent, again, there's that miracle cure or that hope against hope that they focus on. So honestly, at that point, one can only be a support. Are they doing rehab well? Are they sleeping well? Is their mood okay enough for them to function through? I think for me, I've noticed across the years, it's when they transition into the community, that's when they realize that, okay, we need to figure and we need to kind of maneuver our way around this. So initially at the hospital, my focus would be on just relationship building, saying, there as a support as part of the rehab. Of course, there'll be some counseling, psychoeducation. So when you've set that good therapeutic relationship, it's only when they go out is when they message you with that complete motivation, saying, or call you saying, listen, this is what I'm stuck with, can you help? And I think that's where the psychological intervention tends to be the most effective, when they themselves realize that, now we've got to figure this out.
Yeah.
So I mean, I've known people, ever since my practice, who have followed their life trajectories and seen them get jobs, get married, have kids now. And I think that's one of the most fulfilling parts of this journey. So it's never ended. It's still continuing, but just a different part in a different way.
I love that. And I think it's sort of my sort of philosophy is, why not have more proactive maintenance,
Right,
even
right.
in terms of
Yeah,
your physical health, the mental
yeah,
health. Why wait
yeah.
until things have broken down to
Exactly,
get help?
exactly.
And so in that vein, the people you see now, how many of them
Mhm.
actually come to you with a view to being proactive and, recognizing, oh, things are not so great. I don't feel so good. Maybe I should go to a therapist, because there's still a little bit of a stigma around
Yeah,
therapy, isn't there? What's your?
yeah. Are you talking about general mental health or spinal cord
I'm
injuries?
talking
General
about
mental,
gender now. Yeah,
both. Yeah,
yeah,
yeah. So I think I see a mix of both. And honestly, the pandemic brought to the fore a lot that was lying undercover and it was simmering. I think people one realized that our lives need to be put in order
mm,
and we need help. And so they broke those shackles and they've professed it to me, saying, initially I was very hesitant. I thought I'll be able to fix this on my own, but I was resistant to therapy. They will talk about that. A, a large part, I would say, is also coming up from a self development point of view, where they're saying, you know what, I mean, everything's okay, but I want to make sure that I'm functioning at my most optimal bit. So there is a bit of both. I feel definitely the pandemic has led to a lot of people reaching out for help, which I had not seen earlier. And I think that's been one of the turning points where stuff like grief counseling is being spoken about, or PTSD is being spoken about, or just I'm just tired of feeling sad, anxious, depressed, or in a fight with my spouse, so we need help. So I feel the tide is turning for sure.
yeah, yeah. And what about in the relationship therapy area, couples counseling?
Mm, mhm,
Do you find that generally the man and the woman, or it could be two women as well, I suppose, or two men. But
sure.
is it generally led by one person thinking there's a problem and then slightly
Yeah.
dragging the other person along?
Right. Um, that used to be the case, and I would say 9 out of 10 people I would see would be one spouse coming by and saying we need help, and I'm like, where's the other one? And they're like, he or she doesn't think that there's a problem with them. I think again in the last 2 years, I've seen both partners being there, but again the trend that we see is when both come, it's when they both are coming for therapy, it's either that things have become really rough and they can't deal with it, and so that's when they start coming out for help. But again, the trend is shifting where I have more couples now rather than a single person who's coming for couples therapy. But I think the one trend I would like to change is when couples come for therapy when things have gone really, really, really bad,
Yeah,
because at that time there's so much irreversible damage that happens that chances are couples therapy may not work, or one partner's foot is out of the door already. So I would rather that when they notice roadblocks in things like communication or trust or respect or mutual shared goals, when they notice these red flags, I would say it's so much better to just come out and have a discussion with a mental health professional rather than just waiting for when things go really, really south.
yeah.
I, for that matter, tell people please come for premarital counseling because, I mean, honestly, stuff like communication needs to be addressed in such a strong way. And so some people take it seriously, some don't. But let's see, I hope that picks up here as well.
I think that makes so much sense. And of course, we're coming up to sort of Mental Health Awareness Day, and
Mm-hmm.
this podcast actually seems very
Mm-hmm.
well timed in that sense. What would you say are signs that we as individuals should look out for that would
Mm-hmm.
tell us that maybe we need some help? Because a bit like with the couples and relationships,
Mm-hmm.
often we're not self-aware enough
Sure.
see that
Mm-hmm.
this is getting to a place where it's going to get really bad. And so
Mm-hmm.
I should
Mm-hmm.
really get some help now before I get
Yeah.
to that place.
Yeah, I think one general one would be just a level of dissatisfaction with one's life. I think that's been one of the driving forces people have had, saying, I'm just not happy anymore. I don't again know what happiness means, but again, where they notice that they're just everything seems dragged on and they're really, there's just no joy left in what they're doing. I think that for me would be one big indicator saying, okay, you need to come and talk about it. Or if one feels that their mood is generally blue, or there's overthinking, or they're not sleeping well, they're not enjoying what they're doing. I think again, those are strong indicators saying something is amiss that needs to be fixed. So again, I mean, everybody's manifestations may be different, but just in general, a sense of I don't know what's missing in my life, but something doesn't seem right. So if that's a notion that comes by, I think the other thing people tend to get used to is, but isn't stress expected? So, and I will often say that of course it is, but if it's functionally limiting you, if it's interfering with you and impacting the quality of your life, then that's not what's expected. Some stress is fine, but when it's we often feel like, oh, we need to wear this badge of honor of, oh, I can do so much and I'm superwoman and I have all this stress, but look at me doing all of this. But again, you're not doing yourself a favor there.
Yeah,
So, and of course, a lot of people will think that, oh, but this trauma happened to me. How would talking about it help? But again, unresolved trauma, unresolved grief has its ways of impacting you psychologically, emotionally, and like you said, even physically for that matter.
yeah. Um, so in terms of, grief counseling in particular, which is a more specialist area of counseling,
Mhm.
what do you think how do people sort of cope with different kinds of grief? There's obviously
Mhm.
different stages of grief,
Right,
but
right.
what in your experience helped you?
It's such a personal journey that as a therapist, I feel I need to one understand what's the way they would process it better. So I honestly use a lot of workbooks for someone who's very who can't talk about their emotions or can't talk about their feelings in their own private space. They would work on those workbooks, and I think that helps in at least helping them process what they're going through. Honestly, when and I feel like I can now understand when somebody would say time is a great healer. That never worked for me. That never cut it out. I still feel, honestly, Rohini, grief is something, and especially when you lose a parent who you've been so attached to. I'm not even looking for that elusive when will this end, because it comes in cycles, it comes in waves. I'll still have some flashbacks from our hospital days, but again, would I say that am I still suffering from grief? No, it's expected. There'll be triggers that'll come. It's how you deal with them. So for me, what helped was, how do I deal with those flashbacks, with those images, with those memories? What's the, like you use, I love that word, the legacy mom left behind. How would she want us to remember her? And so I think everything I do it with that spirit, and it's helped, of course, ease the pain. But again, does it fill the void? Of course it doesn't. So everybody's trajectory is honestly very different. And again, what led to the demise in the first place? Like, I've had some really difficult challenges where somebody had COVID and they brought it inside the house, and then they lost a loved one to it because they contracted it. So the guilt that comes with having lost a loved one, because you take responsibility for it. There are so many variables of working through grief that it's just such an individual journey and process.
That's so true.
So yeah,
It's the grief of losing someone, but it's also the grief of having survived.
survived, exactly.
Maybe
Yeah,
felt, yeah,
yeah,
see that.
yeah,
And
yeah.
yeah, sorry, you were going
Go
to
ahead.
say.
Sorry. No, go ahead. Go ahead. Yeah.
And I suppose I was going to ask you, when somebody has suffered grief or suffered a
Mm-hmm.
great trauma, very often well-meaning people,
Mm-hmm.
they come in and they think they're saying the right things, but they are just
Mm-hmm.
absolutely
Mm-hmm.
the things you don't want to hear.
Yeah.
What were some
Yeah.
of the things that you've experienced that people
Yeah.
say without realizing just
Yeah.
how crass or how unhelpful those
Right.
people are.
Like I said, I mean, I've been blessed to have the most supportive people, but like, I will always, I mean, I know they came with just the right intentions. And honestly, I've realized, having gone through it, that people struggle on the other end in figuring out what do they say, how do they respond, what do they ask. Like, some people would be like, I would hesitate to ask you, how are you doing? So there was so much, that people themselves were going through in figuring out how do they respond to someone in grief. But like I said, I mean, when they would say time is a great healer, I know that they're saying it because they don't know anything better to say. And I would just nod and say, yeah, I'm sure. So again, that was one where I felt, no, time honestly didn't heal anything for me. I mean, a year after mom's passing, it became even worse for me. And I'm like, I thought time was supposed to heal, but it doesn't. If I was upset, rather than just being there or just sitting or just, it would be like, but your mom wouldn't want you to look to kind of see you this way. And so that doesn't help, because it's not like I'll suddenly like, oh yeah, mom's watching, I better stop crying. But so stuff like that. It was, I mean, I would have loved for somebody to just sit with me in silence and just said, yep, I mean, I'm here for you, and you don't need, I mean, nothing needs to be said. um, I think I honestly hit a point, and I'm sure people who have been my friends, I became very reclusive. I just wasn't meeting people. And I think the ones who truly understood that I was going through stood by me. They never complained, never said, you don't take our calls, you don't respond to messages. I know I was atrocious, but that's what grief made me do. I just didn't have the energy to connect with people. So if some got impatient and decided to abandon, I just kind of said, yeah, I mean, I understand where you're coming from, but grief is a journey which leaves anybody so changed that they don't know how to grapple with it.
Yeah,
So just being patient, just understanding that it's a journey. It's not like somebody can just snap out of it saying, oh, it's been a month, it's been 2 months. Come on, snap out of it. It's something we don't want to be wallowing, but it's just that it just takes its own sweet time to a point where you start functioning well again.
yeah, yeah. That's so beautifully
Mhm.
put. And I think that's it's a good reminder for us all that,
Mhm.
grief changes people
Right,
in ways
right.
that even they don't know.
I wished, and again, I mean, I got a lot of support from people, but I know I kind of dealt with it in my own ways, being in nature, being in silence, processing it in my own ways, using either workbooks or just, this is how I would like my mom's legacy to be. And of course, I think a bit of spirituality helps too, where you're like, they're not gone. And I think that may make sense to someone. It made sense to me, but I know that's not something you can expect everybody else to, because if they're not religious or spiritual, they may not understand the grasp of it. So
Yeah.
yeah, it's such a personal journey.
So I have a final couple of questions.
Hmm.
So we all have, perhaps a sense of what a fulfilled life looks
Hmm.
like.
Hmm.
What does it look like for you?
Hmm. Wow. I've honestly, I love what I do. So that's one for me. And I have a great family. Like I said, it's been something that I've always prioritized. So, I think that's one of the blessings I've had. And if, like I said, I mean, taking care of my dad is the priority now. So if I've done a job well with that, I would consider myself to have lived a fulfilled life. I don't, I mean, I've honestly had two bucket list items. The ultra marathon was one. The other one was seeing the northern lights, whether in Norway or Iceland or Finland, one of those places. I do want to go see that. I think there's just such a beauty to that. And just making sure that you've done something meaningful with your life, that you've made an impact to even one person. And I always feel that if I've even made a difference to one person's life, I would have considered my life well lived. No regrets. If there's anything that I would have done differently, absolutely not living with any regrets. I just feel life has had whatever it's brought, challenges, difficulties, mistakes. There's some lesson in there. So, nothing which I wish I could have done differently. And not worrying and obsessing too much about the future, what it holds. I think one of the ways I make sure that it's a fulfilling life is just live every moment well. And I think that's something which honestly has been a gift that accidentally fell into my lap after mom, was just this whole discovery of, you've just got to be living true to yourself, and that's what makes a big difference. So yeah, I think I'm halfway there. I think it's been a great fulfilled life already, and I think I'm just going to continue in that vein.
Sounds so beautiful, and Northern Lights does sound amazing,
Hmm.
actually.
It
Yeah,
does,
I have
right?
to put that on my bucket list too. So just final sort of maybe your thoughts, this Mental Health Awareness Day, maybe a little bit different to the ones we've had before. I mean, obviously last year we were in the throes of the pandemic and
Hmm.
we didn't really know what was going to be happening in the future. Now we do have an idea, and in some ways, it's a scary place because we're going to this new normal.
Hmm.
And we don't yet know how much of the old normal is going to be included.
Hmm.
So it's a
Hmm.
different kind of anxiety. What
Hmm.
sort of message would you give to people who are feeling very anxious about, this new unknown?
Hmm. Right. I will always say, we have a choice. I mean, we have a choice in how we respond to a situation. So, if there is, and I'm sure, and the uncertainty, the true hardships a lot of people have faced, loss of jobs or financial implications, or, difficult relations that come out, relationships, how they get impacted. What do you want to do in the face of that challenge? How would you want to be? And I think that's one thing I would say, we always have a choice in how we take charge or respond to a situation. So rather than is getting anxious or fretting or ruminating working for you, a lot of people don't realize that they have a choice there. So they're like, oh, but what option do I have? I'm like, what can you do? Can you just, what is the one thing that you can take charge of today which can make a difference to your life? So again, not harboring that helpless feeling that this pandemic has brought to us in such a big way, but saying, how do I want my life to be? How do I want to be in the face of this challenge? And what are the things that I can take charge of? Pandemic's not in my control, but what is it that I can take charge of? So I'll always say we have a choice, and I would always encourage people to choose self-efficacy, taking charge over feeling like it's feeling that they don't have any control.
It's the victim mentality you want to sort of get
Yes.
away from.
Yeah, absolutely.
Yeah,
Absolutely. It's
take,
such a nice place to be in, but yeah, it doesn't work very well at all.
that's right. That's so great. Thank you so much,
Yeah.
Divya.
Thanks,
It's been
Rohini.
such a pleasure. And
Thank
thank you
you.
for
And
sharing.
I loved talking to you, and thank you for making me remember my mom in such special ways. I think I did a good job by not tearing up. I think she'll be proud of me.
Well, there's one thing we missed in that. We didn't
Yes.
we didn't say what your mum's name
Mm.
is.
Oh, Vatsala.
Vatsala.
Vatsala. Vatsala, yeah. Yeah.
Thank you so
Right.
much. And
Thanks, Rohini.
good luck with everything.
Thank you.